The incidence of neurodegenerative disease is at an all-time high. I mean, Alzheimer's, a lot of neurological disease.
Autism.
What we're finding is that neurological function, just like cardiac function, just like sexual function, is dependent upon adequate blood flow. So in all of these patients that have any type of neurocognitive disorders, whether it's Alzheimer's, vascular dementia, Parkinson's, bipolar, ADHD, post-traumatic stress disorder, through imaging, whether it's through SPECT scans or functional MRI or any type of non-invasive imaging, the common denominator in all these is loss of regulation of blood flow. So there's focal ischemia, which means there's a lack of blood flow to specific regions of the brain. And again, when you don't get oxygen nutrients to certain regions of the brain, that part of the brain can't do its job. So whether it's the prefrontal cortex and hypoxia and ischemia and leading to mild cognitive disorders, vascular dementia, and Alzheimer's, all of that, every single chronic disease, whether it's sexual function, cardiovascular disease, or brain health, is dependent upon adequate blood supply to the brain.
That makes sense.
If you don't get the good stuff in and take out the trash, what happens? You get buildup of beta amyloid plaque, tau tangles, all the symptoms and signs of Alzheimer's. Every single Alzheimer's drug that has gone through clinical trials has failed.
Wow.
And why is that? They're targeting the amyloid and the tau tangles. That's a consequence of disease. It's not the cause of disease.
Not the cause.